How are you feeling right now?
Nervous and getting more comfortable.
This is obviously the first time I've experienced anything like this, so yeah, but pretty calm now.
A bit nervous.
I'm feeling rather nervous at the moment, but I am lucky to be here to be able to help in some way.
Tell me what you thought when you first found out we had an outbreak.
I was in disbelief. I couldn't believe that we had COVID in our facility. You see it in the media, all the COVID cases, but you know, it was happening to us and it was real and it was a big shock to all of us.
I was in admin and received the call saying we've got a positive staff member. I think I felt at first, is this real? But then I thought, okay, what have we got to do? And just sort of went straight into motion, you know, making those phone calls. Went into obviously what we'd practice. But it was scary, but I think we just proceeded with however, you know, we've been trained to do, so.
I rang Larissa. She had already put people into PPE and started to get everybody isolated, and I rang the public health and we just went from there. And I was surprised at how calm we were actually.
I felt quite shocked because I never knew about it until I come back from hospital.
Yeah, it was a lot to think about when they first came in and said all doors are shut and things like that. But you just get on with it and learn to live with it.
I was very scared to begin with. My father moved here in July, so I was still in the process of settling in with the idea of my dad being here. And as soon as I've heard about the outbreak, the first thing came to my mind was what's going to happen next. Is my dad and the rest of the residents are going to be okay? So I was very upset, very fearful, to be honest.
I thought it could have been any one of us at any time that could happen to, and hopefully that they were all right and that they would get through it, and then we would all just, you know, follow on and do what we had to do to look after our residents then. So.
At first we didn't know who it was, so everyone was umming and ahhing, and we just wanted that staff member to be, you know, safe and healthy and, you know, pull through, and they did, which is great. But we also thought the worst, you know, one case and then, you know, what's going to happen from here. And, you know, it all changed, you know, on that Monday afternoon when we all found out. We were just all in disbelief and, yeah, went into lockdown. And
I was devastated for them. I kept thinking, you know, how must they be feeling? They obviously, you know, they were devastated themselves from having spoken to those staff members. They were devastated knowing what could potentially happen here.
The mental state of those staff was very concerning, and making sure that we touched base with them, making sure that, you know, it wasn't their fault. You know, this can happen to any of us.
I thought they would feel very bad for themselves, having been the ones that brought it to the facility. But really and truly, it could have been anybody. We don't know who we stand beside. So, you know, I had no ill feeling against anybody, no.
It was very upsetting to know that, you know, these staff, you work with these staff, you know, they're your workmates.
Yeah, it was a bit scary and wondering, you know, well, I knew that some had been taken to hospital, so it was just, and there was only me and another lady up my end, and yeah, it was scary that you're going to get it.
What were you most worried about?
I was most worried about myself at first, about getting it myself. And then once I got in there, I was more worried about the residents and making sure that they had their needs met.
Initially, in the beginning, I was worried about, I think, how many people were going to die, I think. working in an aged care facility and seeing what happened with previous COVID outbreaks and how many loss of residents, I think that was probably the most thing I was worried about, and how were we going to really contain it here at Hawkins. So yeah.
Well, my mum was 97 and we had heard so many bad things as to what is likely to happen, and we were very frightened for that, very worried about that.
I was worried about catching the virus and thought, well, I just have to stay in my room and behave.
We didn't know what was going to happen and if my dad is going to be safe and whether he's going to get it or not. I had to answer my kids about what's going to happen to Granddad. Is he going to be okay?
All the residents and all the staff were tested on that Monday evening. So not knowing what we were dealing with. So then the Tuesday went by, we had no results. So that was probably, I left here on the Tuesday evening thinking, okay, this is a good sign maybe. We haven't heard anything, no news is good news. 5 o'clock in the morning, the public health rang me and said, you have 4 positive residents. Getting that phone call was, wow, what are we dealing with? And then moving forward from that, how many other residents? So by 9 o'clock, we had then the 12.
It was just really real from there on in, and not knowing how much further it would go, whether we would end up with more residents, whether we would end up with more staff.
I felt concerned and upset about how many would get it, and the ones that had it were going to hospital. So, we knew they would be looked after. But then we just had to look after the rest to see if anyone else got it.
I think the greatest fear was to go right through the facility, obviously Acacia House, so potentially those 40 residents all becoming positive. And also the risk was there that it would also move into Banksia House and then potentially move up to Grevillea. So having the 3 sites, that was my greatest fear, that, obviously every resident was potentially going to be affected, and the outcome I knew was not going to be great if that was going to happen.
It was very unnerving knowing that the virus had been in the facility and several patients were taken to hospital, and wondering what the tests are going to bring the next day when they come in, and then sort of waiting for the results. And they'd say, ask the nurse, how many positives? Oh, none today. Oh, phew, good.
Were you afraid of working during the outbreak? What was your greatest fear?
At first, when I first heard, I was a little afraid because I actually went into the rooms to get the people already who had it to go to hospital, pack their bags. But then after a while, you lose that fear. The fear goes and you just get on with the work, and you know that there's people there that you have to look after and help. So the fear goes and you become satisfied in a way. It becomes very satisfying in a way. So.
How did it feel when you tested positive to COVID-19? What was your biggest fear?
Just that I mightn't make it through it. I was a big shock. I couldn't understand that I could have it. I was quite comfortable because I knew that I was quite well. I just put my trust in the doctors and nurses.
Well, Mum's first test was negative, and we were very happy for that. The next day they phoned us back to say that it was positive and she was going to hospital. Our worst nightmare. Wasn't quite sure how Mum would cope. We were very fearful, and that she may not come back the same as she went in. She was quite active before she went, And apparently they were in a room on their own. And everybody, the staff, I guess, she's very comfortable with everybody here at home, with her family at Hawkins. And she must have been terribly frightened. And that was the most upsetting thing for us.
Yeah, obviously I think families were very fearful of what would happen, and they hadn't seen their family members for quite some time.
For me, as the outbreak progressed, I felt better because I've been given updates all the time. So I felt more relaxed, less stressed.
All the precautions were being taken. We knew the staff had things in order and would be looking after everybody as well as themselves.
And I just knew that everything is going to be okay.
What was the biggest challenge of having so many staff self-isolate at the same time?
Not having many people on the floor. We had very limited staff for the first couple of days. There was activity officer, cleaner, one AIN, one doing the medications. So there wasn't a lot of us, but we did manage.
Yeah, so we were lucky enough to have team members come from Sydney, and they stayed on site. In the Hunter area, registered nurses and staff members come to join us.
And also when the people came in from outside, they didn't know the residents, so they had to get to know what they were like, what their needs were.
We're used to such high standards here at Hawkins, and having people come in that don't know them, I was worried about that.
We were really stretched, but people helped where they could. And yeah, I know the staff who had self-isolated, they would be here if they could have also. I think it was really tough on them as well to sit at home, when most of them were doing okay.
So I was one of the staff who had to isolate early in, and I think the biggest challenge for the staff that did have to isolate was not being able to be there for the residents and, get in there and help everyone with such the little staff we had. And, we're all just so proud of all the staff that just got in there, did a great job, and just beyond proud.
Did you feel supported during the outbreak?
Yes, definitely. From the word go, it felt that everyone sort of just picked up and did whatever we could at the time. Everyone was just doing things for each other. As far as the whole of RFBI got in and helped, whether it be a little job or whether it be a big job, everyone got in to help each other. Like I said, it takes a village to rear a child, but it really took a whole RFBI team to obviously get through this. So there's no way we would have been able to do it on our own.
Can't thank everybody enough. There was support from everybody, the head office team, other villagers, people on site, the leadership team, the RGMs, the GMs. We had lots and lots and lots of support, and as Larissa said, we could not have managed this without that support. People just rallied around and did what they had to do, and above and beyond.
Yeah, I definitely feel like I was supported. All I can say is that we have a great management team here and leadership team, and every day they were ringing, checking on me and all the other staff in isolation as well, and is there anything I can do for you? They were just great. I felt really supported throughout it all.
From the staff here, we had constant phone calls checking on us all. They would inform us of anything that was happening. Then we also had lots of emails from head office and all telling us of what was going to happen and what have you. Yes, no. Everybody was wonderful, yes.
As for the residents, they ask questions all the time, asking how everyone is. As it's, it's their family as well here.
When did your residents come back, and how did it feel to have them back?
The residents came back at day 15 from exposure. We were happy for them to be back and to see their smiley faces again, and obviously for them to come back home was, they were very happy. So, so it was a positive thing.
It was a really good feeling to know that they were all well, and that, things were getting back to normal.
I think it was just such a big relief for all of us just to have them back there, healthy and happy, and yeah.
From to be all together again, it was a good feeling. They were all so glad to be back. And the ones who were isolating, the residents who were isolating, they were so happy to be out of their rooms because they'd been in there and they'd been so good for all that time.
Well, when we were finally allowed out, it was heaven all over again.
How do you feel now that it is over? Was it as bad as you expected?
Obviously relieved. It's all over. Some days were bad. I know I experienced probably every emotion I think that you can actually experience that as a human. There was times of happiness that we actually did it. Obviously, there was times that, I did cry thinking, wow, what's going to happen next, and I think so that was...
I felt very satisfied when it was over, like we'd accomplished such a great thing to helping the residents. It was probably more than I expected. I didn't expect for us to pull together so well and to accomplish what we did. I always said I'd do it again, and I think everyone there said if anything come, we would go and do it again. Yeah.
I felt so pleased that it was over, but I've always had a strong faith.
I feel that it's really good. It's more relaxed and feels more like home.
I didn't feel that it was as bad as what I thought it would be, and that was because of the support and great teamwork. We had a great team.
I was just really proud of everyone, we pulled together as a team and we got through it, and if it was to happen again, God forbid it doesn't, but I feel like we would be better prepared and, we can handle anything as a team.
What message do you have for other teams who may experience an outbreak?
Just remember why you're here. We come to work every day to look after the residents, so just remembering that, I think, we're here to help them. Ask for help if you need it. I think that's probably the biggest thing. You can't do it alone, so make sure that you put your hand up and do ask for help.
You've got this, you know what you're doing, you'll do it well, and we are here to help. And thanks for everybody's support. So, just do what you know.
Have complete faith in management and staff here because they have already shown us what they're capable of throughout a very, very difficult time. I just would like to take this opportunity to thank management and staff for an amazing job they've done. You guys are awesome. You guys are amazing. You've managed this outbreak really, really well. I just couldn't fault anything. I just want to wish you all the best. I hope that everyone's safe and happy. And thank you from the bottom of my heart for everything you've done for our families and our community. Thank you so much.
Thank you from me as well, and I agree wholeheartedly.